Hi, Dr. Pirani.
Hey,
I've been hearing a lot about internal bras in the media. What is that?
yeah, so an internal bra can mean many different things. It's a way of supporting the fold and the lower third of the breast when you put an implant in there. When you put an implant in, it does tend to stretch tissues out. And there's two ways you can get sort of a stretching out of the bottom of the breast. One is just the skin stretches out, and we don't really have a way of stopping that. The other one is that you actually lose control of the fold. And so where the fold is, where the breast meets the chest, actually starts to drop. And that's really what we're trying to prevent with the internal bra techniques. Now, internal bra can be as simple as just reinforcing that fold with sutures, which is something I always do and have always done. So that form of an internal bra is universally done in my practice. The other kind of internal bra that can be done is taking a piece of external tissue and putting it in, and that can either be a piece of a material called Galaflex, which is off-label currently in Canada, but we can get special access and do it, and that just sort of acts as a reinforcement of the fold. The other way to do it is to use something called acellular dermis, which is basically unliving tissue that's been taken from someone who's passed away. It's been treated, so there's no living cells in it, and using that to reinforce the fold. That is Health Canada approved, but is a lot more expensive. So people tend to go for the Galaflex option. I don't use that on everybody. I use it in select cases, which we can talk about in your consultation.
Awesome. Thank you.
You're welcome.